For manual muscle testing of the wrist flexors are flexor carpi radialis and flexor carpi ulnaris. For flexor carpi radialis movement, the starting position for the against gravity test, the starting position is while the patient is sitting with forearm in supinated position and hand in or wrist in flexion and ulnar deviation. And stabilization is applied just proximal to the wrist joint, and the patient is asked to, for grade 3, is asked to move your hand upward and toward radial deviation. Grade 3. Grade 4, moderate resistance is applied. Move your hand upward and toward medial radial deviation. For grade 5, maximum resistance is applied, and the resistance direction is applied toward wrist extension and ulnar deviation. And be sure here to avoid substitution movement. Substitution movement may be done by flexors, long flexors of the fingers and palmaris longus or flexor carpi ulnaris. So you have to ensure that there is no participation of the flexor carpi ulnaris and the long flexors of the fingers. And the patient is asked to keep your fingers in relaxed position. Again. Okay. For gravity eliminated test of flexor carpi radialis muscle, the patient in sitting position and the forearm in slight pronation, and proximal stabilization is applied just proximal to the wrist joint, and the patient is asked to move your hand in toward flexion and radial deviation. Relax. Again. Relax. For palpation of the flexor carpi radialis muscle, the palpation is applied here on the anterolateral aspect of the wrist joint, just on the radial aspect of the palmaris longus muscle. The palmaris longus muscle tendon is can be shown when the patient takes this position, flexion of the fingers and the cupping of the palm here. On the radial aspect, this tendon is the tendon of the flexor carpi radialis longus. Be sure that the palmaris longus tendon is not present in all people. For wrist flexion, flexor carpi ulnaris muscle, the patient starting position is sitting and the forearm is supinated and the wrist in extension and radial deviation. This is the starting position. Stabilization is applied just proximal to the wrist joint, and the patient is asked to move your hand toward flexion and ulnar deviation. Okay, grade 3. Again. For grade 4, moderate resistance is applied on the hyposenar muscle, hyposenar part of the hand, and the patient is asked to move your hand toward ulnar deviation and flexion. Relax. Again. Relax. For grade 5, maximum resistance is applied in the same manner. Relax. Again. Hold. Relax. Substitution for this movement can be occurred by the action of the muscles flexor carpi radialis or long flexors of the fingers. So the patient is asked to keep your fingers in a relaxed position. Okay. For gravity eliminated test of the flexor carpi ulnaris muscle, the patient in sitting position and the forearm in slight supination, and proximal stabilization is applied just proximal to the wrist joint, and the patient is asked to move your hand toward flexion and ulnar deviation. Relax. Again. Okay. Relax. Palpation of this muscle is applied here just proximal to the pisiform muscles here on the ulnar aspect of the wrist, antero and the ulnar aspect, anterior and ulnar aspect of the wrist joint. Move, relax. For assessment of muscles of the wrist joint, flexors of the wrist, the flexor carpi ulnaris and flexor carpi radialis in neutral position. The wrist in extension position. This is the starting position, and the patient is asked to move your hand upward. Relax. This is grade 3. Grade 4. Moderate resistance is applied on the palm of the hand. Relax. Again. And the resistance direction here is toward the wrist extension. Grade 5, maximum resistance is applied. Hold. Relax. For gravity eliminated test for wrist flexors in neutral position, the patient is sitting and the forearm in mid position, and proximal stabilization just proximal to the wrist joint is applied, and the patient is asked to move your hand toward the wrist flexion. Relax. Again. Relax. And palpation is applied on the flexor carpi ulnaris just proximal to the pisiform bone here, and palpation of the flexor carpi radialis is applied just on the radial aspect of on the anterolateral aspect of the wrist joint, just radial to the palmaris longus tendon. Move your hand toward flexion. Relax. Move your hand toward flexion. Relax. For the manual muscle test of the wrist extensors, the muscle responsible are extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris. To apply manual muscle test of the extensor carpi radialis longus and brevis, the patient starting position is sitting and forearm in pronated position, the wrist in complete flexion and ulnar deviation, and the fingers is relaxed. The fingers are relaxed. Stabilization is applied just proximal to the wrist joint, and the patient for grade 3 is asked to move your hand upward and toward radial deviation. Relax. Grade 3. For grade 4, Moderate resistance is applied here toward wrist flexion and ulnar deviation. Move your hand upward and toward radial deviation. The patient is asked to keep your fingers straight, keep your fingers in relaxed position, semi-flexion. For grade 5, maximum resistance is applied and asked to move your hand upward and toward radial deviation. Relax. Again. Hold. Relax. Substitution movements that can occur during wrist extension and radial deviation is extension of the long flexors of the wrist, long flexors of the wrist and fingers, and the extensor carpi radialis, extensor carpi ulnaris, and extensor digiti minimi and extensor indicis. The action of all these muscles can cause substitution movements for wrist extension and radial deviation. Move your hand. For gravity eliminated test of the extensor carpi radialis longus and brevis, the patient is in sitting position and the forearm is in slight supination, and the patient is asked to move your hand toward wrist extension and radial deviation. Relax. Again. Relax. The palpation is applied for the extensor carpi radialis longus is applied in line with the second metacarpal bone, just at the base of the second metacarpal bone here. Move your hand. Relax. And the extensor carpi radialis brevis is palpation is applied on the base of the third metacarpal bone here. Move your hand. Relax. Again. Relax. For the against gravity of the extensor carpi ulnaris muscle, wrist flexion, wrist extension and ulnar deviation, the patient's starting position is wrist flexion and radial deviation, and the patient is asked to keep your fingers relaxed. For grade 3, stabilization, proximal stabilization just proximal to the wrist joint, and the patient is asked to move your hand upward and toward ulnar deviation. Move. Relax. Again. Relax. For grade 4, moderate resistance is applied here on the fifth and fourth metacarpal bone. Move your hand upward and toward ulnar deviation. Relax. Again. Relax. For grade 5, the resistance is applied here also. Move your hand upward and toward ulnar deviation. Hold. Relax. Resistance direction is applied toward wrist flexion and radial deviation. Substitution movement which can occur here is extension of the wrist or extension by the action of the long extensor of the fingers and extensor carpi radialis muscle, and extensor indices or extensor digiti minimi. For gravity eliminated test of the extensor carpi ulnaris muscle, wrist extension and ulnar deviation, the patient position is sitting and the forearm in slight pronation, and the hand, the stabilization is applied just proximal to the wrist joint. The patient wrist starting position is wrist flexion and radial deviation, and the patient is asked to move your hand toward extension and ulnar deviation. Relax. Again. Relax. And the palpation is applied for the extensor carpi ulnaris on the dorsal aspect of the wrist, just distal to the ulnar styloid process. Move your hand here. Again. Just distal to the ulnar styloid process on the dorsal aspect of the wrist joint.